I'd now like to introduce Mr. Jim Simpson, who is Senior Advocate of the New South Wales Council for Intellectual Disability. Improved healthcare has been an advocacy priority for Jim for many years. His goal is accessible and quality access to mental health services for people with intellectual disability, and his topic today is health advocacy. Thank you, Jim.
Yes, New South Wales Council for Intellectual Disability, we've been a peak advocacy body for people with intellectual disability and their families in New South Wales for 60 years. We've evolved from being an organisation that made decisions for people with intellectual disability to one where people with intellectual disability and families and advocates and professionals sit round the table and lead our organisation. And yes, we've been focusing on health issues for over 15 years as a particular priority, and that's been driven primarily by the experience of our members and our constituency. People who come to us with the difficulties that they've faced in getting the health care that they need. So people where someone's behaviour has been off the air, the response has been psychotropic medication and then more psychotropic medication until it's worked out that the person has a major dental problem. And once the dental problem's fixed, the behaviour goes away. People where major depression is not being diagnosed on the assumption that it's just around the behaviour associated with the disability. Well, one of our board members whose son had enormous difficulties with challenging behaviour from a very early age, finally in his 30s, a very clever psychiatrist with expertise in intellectual disability tentatively diagnosed bipolar disorder and prescribed a mood stabilising medication. Fundamental difference to the life of that young man. So we tend to get initial action through the experience of our members, but what's really valuable is where we find that the research evidence coincides with what we're hearing. We've heard a bit about this already, so I won't dwell on it, but the sum total is about 45,000 people in New South Wales have intellectual disability and a mental disorder. Schizophrenia at about 3 times the level in the general population. Major problems with mental disorders being undiagnosed or misdiagnosed. And poor access to treatment. Psychiatrists survey and report that they feel that people with intellectual disability have poor access to mental health care. Particular problems for people involved with the criminal justice system. Work done at this university shows that 60% of prisoners in New South Wales who have an intellectual disability also have a mental disorder. And 70% also have an alcohol and other drug disorder. So major co-occurring disabilities there which need to be treated holistically. Well, what are the barriers? And those anecdotes I spoke about at the beginning, in each of those cases the person had a major difficulty with verbal communication. And so that obviously makes it much harder for mental health professionals to work out what's going on. Atypical presentations, a term, I'm a lawyer, I don't know a lot of this jargon, but people like Julian Troller and David Dossiter have educated me a little bit over the years. And yes, atypical presentations, mental health disorders manifesting themselves differently in people with intellectual disability compared with what you would expect in the general population. Diagnostic overlay. In other words, the assumption that the problem with the behaviour is related to a disability, related to the disability, rather than related to a possible mental health disorder as well. On surveys, psychiatrists and GPs say, look, we are inadequately trained to work with people with intellectual disability. And a lot of this stuff is obviously very complex. We need to build up the general workforce as the Core Competencies Framework is aimed at. But we also need, just in so many areas of medicine and psychiatry, we need the tertiary experts, the Julian Trollers, the David Dosseters, to be available to be a source of consultation and training and research for the mainstream. And so far we've got all too few of those. Finally, and the Minister really made this point well, we need to collaborate. So collaboration between health and disability services and schools, justice services is so important if we're going to adequately meet the needs of people. Too often in the past, the approach has been much more one of demarcation. Disability services sort of saying, look, this is the responsibility of mental health services saying, no, it's the responsibility of disability services. Collaboration has to be the more and more the way of the future. And we have made some useful steps in that direction. Well, look, we're seeing today quite a lot about a way forward. But what are the policy drivers of that way forward? Well, fundamentally, there is the Convention on the Rights of People with Disability, which is where an advocacy mob like mine comes from. People with intellectual disability have the right to the highest standard of health care. But, those sort of laudable goals, of course, are just a start. In a much more concrete level, we've got the National Disability Strategy, which doesn't have the profile that it deserves. It's an agreement by every government in Australia, signed by all premiers and chief ministers and the Prime Minister, for all mainstream services, such as health, such as mental health, such as transport, to lift their game over time in relation to how they respond to people with disabilities. And the National Disability Strategy specifically talks about the obligation that mental health services have to raise their game generally, and whenever there's reform going on, to be making sure that reform specifically includes people with disability. In 2013, with the support of the Commonwealth Department of Health, my organisation led a national roundtable on the mental health of people with intellectual disability. That was in collaboration with Julian and some other leaders in intellectual disability health. And that brought together the chief mental health bureaucrat and/or chief psychiatrist from every state and territory and the Commonwealth. It brought together the presidents of the relevant professional colleges. It brought together senior representatives of disability departments and so on and so on. And we disability advocacy groups. And what that produced was a consensus statement about the key elements of reform that are needed so that people with intellectual disability get fair access to mental health treatment. Very consistent with the outcomes of the round table is the strategic plan for mental health in New South Wales that was developed by the New South Wales Mental Health Commission, and the recommendations of which were fully adopted by Premier Baird when he released that strategic plan in 2014. So those are the drivers towards where we need to go. And there are common elements in all of those drivers. Relevantly, equitable access to mental health services. Now, I well know that you guys who work in mental health services are constantly stretched. You would often think if only we had more resources, we could do a whole lot more. But what I think is utterly reasonable to expect is that people with intellectual disability, get a fair slice of the mental health cake. So equitable access, rather than the tendency that has sometimes been used to sort of say, well, look, we just aren't funded for this, and it's the responsibility of disability services anyway. Developing skills in treatment and training of health professionals, and the Core Competency Framework obviously has a valuable role there. Development of our network of specialists to back up the mainstream. We've got a sprinkling in New South Wales. We're probably better off in New South Wales, frankly, than any other state. But we've still got a hell of a long way to go before so many of you who are out there in mental health services can get the specialist backup that you need when you need it. And finally, again, collaboration between service systems. We need to get a whole lot better at this. One of the key areas of collaboration has to be with the National Disability Insurance Scheme. Now, the National Disability Insurance Scheme is basically an extremely exciting opportunity for people with disability to get the support that they need without rationing of services and on a person-centred basis. So the number of people who will receive disability support is going to grow enormously. The amount of money going into disability support is going to grow enormously. At the same time, there is a legitimate concern about what will happen with addicts' departure from the disability scene and some of the specialist structures that are in there in relation to top quality behaviour support and collaborative structures with mental health services. Now we are very active, as I'm sure are lots of you in the room, in insisting that those issues about the future, the need for ongoing specialised disability behaviour support and so on be met. And I think there's a rising tide of recognition not only that needs to happen, but that we need to work out how it's going to happen from the NDIA and from ADIC as it departs. So there's no clarity about how that's going to work out, but the future has to be in collaboration with a service system that is going to mean that people aren't just getting disability support if they are lucky enough to have got to the top of the queue, but where support is available under the NDIS based on need. 3DN, the Department of Developmental, Disability, Neuropsychiatry, and Julian Troller's team, the way they have led that centre, has been one of the biggest, not breaths, but wonderful nor'easters that has blown through the disability scene in Australia for many, many years. And I'm sorry that Minister Gowd isn't here to hear me say that, because I wanted to specifically congratulate Minister Gowd on the fact that that service, which was initially set up and funded by ADIC, she and her department are now providing ongoing financial support too. And the Core Competencies Framework is just a further one of the terrific resources that are coming out of Julian's team. And as Julian said, it is a step-by-step sort of process. But I suppose all I feel I need to say about the Core Competency Framework is that, it is one of the keystones for change. It's one of those pieces of stone in a wall that's still being built, but it's an essential stone towards the direction in which we want to go. Thank you very much.